How accurate is a progressive supranuclear palsy diagnosis? How accurate is a diagnosis of progressive supranuclear palsy? This is a question many face when dealing with this complex neurological disorder. Progressive supranuclear palsy, often abbreviated as PSP, affects movement, thinking, speech, and vision. Diagnosing PSP can be quite challenging, primarily due to its similarities with other neurodegenerative diseases, particularly Parkinson's disease and Alzheimer's disease. The accuracy of a PSP diagnosis can vary significantly based on the criteria used and the stage of the disease. One major challenge in diagnosing PSP is the variability in symptoms. Individuals with PSP may experience a range of symptoms, including difficulty moving their eyes, balance issues, and cognitive decline. However, these symptoms are not unique to PSP and can also appear in other conditions, complicating the diagnostic process. Historically, the National Institute of Neurological Disorders and Stroke and the Society for Progressive Supranuclear Palsy have provided diagnostic criteria. More recently, the Movement Disorders Society introduced updated criteria in 2017, which aim to enhance diagnosis by considering various PSP phenotypes and a suggestive category. While these new criteria improve sensitivity, they may slightly reduce specificity. When we look at the accuracy of diagnosis, studies indicate that the clinical diagnosis of PSP can be highly specific, often exceeding 99%. However, its sensitivity is generally lower, ranging from about 9% to 20%. This means that while a diagnosis of PSP is likely correct when made, many cases may not be accurately identified until later stages or even confirmed at autopsy. Pathological examination remains the gold standard for confirming PSP. In one study, 78% of clinically diagnosed PSP cases were confirmed through pathological examination. This highlights the importance of definitive testing in confirming the diagnosis. Comparing PSP with Parkinson's disease reveals additional complexities. Both conditions share some symptoms, but PSP typically involves more pronounced difficulties with eye movements and a more rapid progression of symptoms. The diagnostic criteria for Parkinson's disease tend to have higher sensitivity and specificity compared to those for PSP, reflecting the inherent challenges in diagnosing PSP accurately. For individuals suspected of having PSP, a comprehensive medical history and physical examination are crucial. Since there is no single definitive test for PSP, diagnosis often relies on ruling out other conditions and observing the progression of symptoms over time. Ongoing research and advancements in diagnostic criteria are aimed at improving the accuracy of PSP diagnosis, which is essential for effective disease management. In summary, while diagnosing PSP can be quite challenging and often occurs in later stages, recent improvements in diagnostic criteria are helping to enhance accuracy. However, pathological confirmation remains essential for a definitive diagnosis. Always consult healthcare professionals for personalized medical advice and guidance.